It's a fact that women age differently than men. Beginning in the perimenopausal stages, as we lose our estrogen, we ramp up the production of subcutaneous fat, which produces estrone to replace estradiol that our ovaries used to make. But something else happens deep within our abdominal region, and it's the accumulation of visceral fat. Visceral fat is different than subcutaneous, and it leads to 7 of the top 10 killers of women, which are heart disease, heart attacks, breast cancer, colorectal cancer, Alzheimer's disease, stroke, and type 2 diabetes. This type of fat is metabolic and it releases pro-inflammatory cytokines into your bloodstream. It's packed very tightly up against all of your vital organs and it sits very close to the portal vein, which transports blood for the intestinal area into the liver. And this causes fatty acids to be deposited ectopically into your liver, which causes insulin resistance and high blood lipids. But do you know that in perimenopausal women, it's not calories that cause the buildup of visceral fat? In fact, you can be skinny and still have an alarming amount of visceral fat packed deep within your body. So what is the cause exactly? It's testosterone. When women lose their estrogen and progesterone, it causes testosterone to become more active because it's unopposed. Scientists aren't sure why testosterone causes the increased visceral fat in women, but in a study done in 1997, a group of 10 women undergoing gender reassignment treatment were scanned at both the 1-year and 3-year marks since beginning their treatment. And the first year, these individuals had less subcutaneous fat, but more visceral fat. And at the end of the 3-year mark, all of them had more subcutaneous fat, and their visceral fat amount had increased on average by 47% over baseline numbers. I will link the studies below for you. And I'm saying this because many women are now taking testosterone creams to increase their libido, and they should be aware of the health implications down the road. So the good news is that unlike subcutaneous fat, visceral fat is easier to get rid of if you do some specific things. The first thing you can do is you can have 1 avocado every day. In a study published in September of 2021 at the University of Illinois, 105 participants who were clinically obese and were given specific meals to eat every day had a very interesting outcome. One group had meals that included avocados, and the other group had meals without the avocados. At the 12-week mark, all of the women who were in the avocado group experienced a drop in visceral fat volume, but the men did not. The other thing that impacts visceral fat are turmeric. Specifically, one of its components, curcumin, has an effect in the reduction of fat. And then the other nutrient that you want to include in your meals is fiber. So if you're a menopausal woman, you can now look at these changes within your diet to make a long-term difference in your health.